I am Dr. Christine Horner. I'm a former surgeon and now an expert in natural health, and I am the owner of Dr. Christine Horner's Medical Thermography Group of Southern California. So I'd like to share with you today some of the points about thermography, what it is, and the ways that it can help to benefit you and to help you in your health journey. So first of all, medical thermography, what it is it is the only non-invasive, non-contact, pain-free, radiation-free, FDA-approved, completely safe physiological test that uses an infrared camera to be able to assess and monitor your overall health. We like to use it primarily as a health discovery tool, and what it's doing, kind of in the most simplistic level, is it is measuring the surface temperature of the skin. Now, the human body is remarkably symmetrical, so whenever there's a little subtle differences between the two sides, that's something that can alert us to maybe there's something going on that side that needs some further investigation or some attention. This all has to do with a sympathetic nervous system response to the skin, and what it's responding to is underlying issues with pain, pathology, injury, or dysfunction anywhere in the body. Thermography, as I said, is something we like to use as a health discovery tool, ideally. So instead of mining for or looking for disease, we want to use it as a health discovery tool that's showing us physiological situation in somebody's overall body. Again, this is a non-invasive technology, so it's does not cause any harm at all. It will alert us to physiological changes, directing us to when further testing might be indicated. We can also use it to monitor whether our treatment approaches are working or not. And then it serves as this incredible motivational tool for people to kind of stay on a healthy diet and lifestyle. If you're able to visually see the improvements with your healthy diet and lifestyle, then there's a remarkable phenomenon where most people really are motivated beyond anything that I've ever witnessed as far as staying on a healthy program. So we're really trying to engage people in their health with the use of thermography. Now, thermography uses infrared light, and you can see from this diagram that the visual light spectrum is actually pretty darn narrow, and then above that is where we can get into some damaging rays like X-rays and gamma rays, and below that is where the infrared spectrum is, as well as the radio waves, and those are completely harmless to the human body. Now, thermography is actually not new, and surprisingly, there was some reference in 1700 BC in the papyrus that noted that there was diseases actually had an association of palpable heat on the surface of the body. 400 years BC, Hippocrates, which is considered the founder of modern Western medicine, he said that in whatever part of the body where we find excess heat or coolness where it's felt, that's where disease is to be discovered. And they actually used mud that they put on the body and then determined what area dried the fastest, and that's the place that had the most heat. So again, we're kind of showing that pattern where the issue or the disease is right where that mud is drying and producing excessive amount of heat. Thermography in its more modern sense is actually pretty new. So back in the 1800s is when Herschel discovered the brand new spectrum of visible light, the infrared light. And then the first infrared camera was developed in 1929 during World War II, and also the Korean conflict. It was used by the military to see the enemy at night because we're detecting heat. And then it started to be used for medical purposes in the 60s, let's say, and kind of early 70s is when the Department of Health and Education and Welfare said that thermography was beyond experimental and included multiple areas, including evaluation of the female breast. Now, big advances occurred in the 1970s with computerizing thermography. So these mini computers were put into the systems, and they had a color display and allowed us to do these image analysis using the computer rather than just kind of hand calculations. So that was a huge advance. And now we're really able to see with a very highly refined computerized, system, that we can see that even the tiniest kind of subtle temperature variations in the human body, and its applications are now really beneficial for many different areas of medicine, including neurology, vascular medicine, sports medicine, breast health, physical rehab medicine. The very first camera was huge. Actually, the ones that was used in 1956, very, very huge. And as with most of our technologies, they get smaller and smaller with use. So now the top of the line infrared camera is considered the FLIR camera, and it's fairly small. And again, it's able to detect, it uses an infrared camera to detect the heat and the temperature variations in the body, and then it goes through a conversion into a software program that is able to then do a digital display of images, color images on the computer screen. Now, the resolution of the camera is something that's extremely important. Years ago, we had this much lower resolution camera, and you can see that there's a huge difference between that and then the 640 by 480, which is the type of camera that I use in my medical thermography practice. And you can see the eyelashes here, we always kind of point those out, whereas you're not going to see that when you have this much lower resolution camera. Now, there's still companies that produce that low resolution camera that are being used today. And I think it's really important to get the highest resolution cameras so that we can get the more specific type of details that's helpful in infrared thermal imaging. There's many different conditions that can create thermal patterns on the skin. So one thing that thermography can be very helpful for is if you have unexplained pain. So it can help to locate where that pain actually is originating. Also looking at inflammation. So there's specific patterns that we see, and we'll talk about those a little bit later, that can give us an indication of how much inflammation is in the body. We can also get some changes in the overlying skin for some of the internal organs like the liver, spleen, pancreas, intestines, not so much on deeper structures because it's very far from the skin surface. So things like the female organs, the lungs, the kidneys, those things we usually don't see thermal patterns for. Digestive issues will create a thermal pattern, particularly leaky gut, any kind of thyroid problems. There's certain points we can look at that give us an idea of the what's going on with your immune system, whether it's healthy or whether it's maybe not as robust as we would like it to be. Things in the head and neck area like TMJ, dental issues, sinus issues. Chiropractors will use thermography in particular for looking at what's going on with somebody in their back and what the soft tissue inflammation situation is. Lymphatic congestion has particular appearances and patterns that we see with thermography. Sometimes we'll see in hormonal imbalances, and then thermography can also be used for injury assessment and for musculoskeletal issues. Now, looking at the head and neck, on the left-hand side is what we're looking at, which is kind of normal patterns. When I do an interpretation, what I'm doing is I know what the normal patterns are in every area of the body, and then we're comparing what each person's individual thermography scan is that, to what that normal is to determine, okay, is there something going on there or not? We also have all sorts of different guidelines that we follow that tell us specific temperatures, which are considered significant. So it's absolute temperature measurements are done. And then also we're doing measurements between the two sides of the body, looking for any abnormalities in symmetry. So on the right-hand side of your screen, you can see where there is some inflammation, and that's in the frontal sinuses. So that could be indicating that a person might have sinus inflammation going on. The maxillary sinuses are in the cheek area and are encased in bone. And so this is kind of an interesting phenomenon that occurs with thermography, where because it's a physiological test, it's not an anatomical test, it's a physiological test. And it can get kind of confusing because you're looking at these pictures and it looks like you're looking at, like a anatomical kind of view of a person, but you're not. It's a physiological view. And so sometimes where the temperature variations occur, they're not right over where the anatomical structure is. And so this is true for the maxillary sinuses, where we don't see the temperature changes right over where the sinuses are, but they will cause the area in the infraorbital area below the eye to heat up. So on the person on the right there, you can see where there's inflammation that's under the eye there, and that's what we see with maxillary sinus inflammation. And then we are also able to see dental issues here too. Now, because thermography measures the surface temperature of the skin, we can't tell you exactly what it is that's underlying that, that's causing that heat pattern. In that area, it's going to be either the teeth or the gums. Oftentimes I'll tell clients that have issues in the dental area that they should, the next time they see their dentist, that they should tell their dentist that their thermography showed inflammation. And maybe there's just on one side or the other. Sometimes we can locate it even more and just have them take an extra careful look there to see if there's anything going on that's significant. On the lateral view, we see that the external ear is really cold. And so anything that is actually above the surface of the skin is going to look cold on thermography. So the nose, for instance, right here is kind of above the surface, and you can see how cold it is. So blue is cold and red is hot in this particular color palette. Same thing, the external ear, because it sticks up, is going to be nice and cold. Anytime we have any kind of depression over from the surface of the skin, then we're going to actually have heat associated with that. So here's where the ear canal is, and white is considered our hottest temperature, black is the coldest temperature, and that's the ambient temperature. Now, when you go right in front of the ear, you're going to see this area right here, and that corresponds with the TMJ, or the temporomandibular joint. So that's the temporal bone, and then the mandible, right here where it joins together. That can become inflamed most commonly when somebody might be grinding their teeth and maybe they don't even realize it, or if their occlusion is off. So this is another finding where I'll tell a client, next time you see your dentist, let them know that you had some inflammation in the TMJ, whatever side, or if it was both sides, and have them check to see if you're grinding your teeth and you need maybe a tooth guard, at night, or if something's happening with your occlusion. We also see heat patterns that are right behind the earlobe. That's where the mastoid process is. A lot of different muscles insert there that are involved in chewing. And so sometimes people can have problems with headaches and neck pain and even ear symptoms when they have inflammation that is in that particular location. Now, the nose, as I told you, should be cold. So this is what the normal nose should look like. There are conditions when the nose looks abnormally hot. And there's a couple different things that can cause that. If somebody actively has a cold, we'll see the nose is hot. Also, if there's sinus infections going on, and you can see a huge amount of inflammation on this person around their maxillary sinuses that even carries down to around the mouth, most likely that has to do with sinus issues. Sometimes we don't see as much, sinus issues with that, and a hot nose could mean that somebody might have high blood pressure. We'll see the same thing if your ears turn out to be hot on both sides, then that would be an indication that a person might have high blood pressure. On the anterior neck, we're looking for the thyroid and also for lymphatic drainage from the mouth. So in this instance, this person has some heat patterns that are going around the mouth. Usually whenever we have heat around the mouth, we're going to see some drainage from the lymphatics in the neck. This person doesn't have a whole lot of that, so it might be that maybe the heat pattern and the fact that it's kind of diffuse, there might be maybe they drank something hot before they had their thermography done, and so that's part of the pre-instructions, is not to drink anything or eat anything beforehand, but it certainly could be. Whereas this person, you can see where they've got a lot of inflammation that's occurring mostly on the right side that's coming down. Again, looks kind of sinus related, but there is some activity we see in the mouth. We're using different palettes here that are kind of accentuating the heat pattern, so you can see very clearly where we've got that going down into the lymphatics into the neck. Now, the thyroid gland is located located right kind of in the center of the neck. It's a little bit lower than this. And really interestingly, this is another one where a lot of times the patterns for the thyroid will see slightly higher than where the anatomical structure for it is. If somebody has a significantly underactive thyroid, we'll oftentimes see this cold blue pattern over it. And then sometimes if somebody's hyperthyroid or they've got an inflammatory condition of their thyroid like Hashimoto's, thyroiditis, then they may have a heat pattern over their thyroid. Now, the immune system is kind of interesting where there's a couple different points that we have that can give us an indication of how healthy it is or if it is kind of depressed. And so in traditional Chinese medicine, there's a particular point that goes over the second thoracic vertebra, which is right over what we call T2. And that point in traditional Chinese medicine has to do with the immune system. So interestingly, we use a different palette to be able to see it, but you can see where there's kind of a cold circle right over where the T2 area is. And so that could be an indication that the immune system is a little more weakened than we want to have it. And so there can be an approach to really help to strengthen a person's immune system. Another point that we'll see for the immune system is right in the center of the chest. Sometimes we'll get a cold spot, corresponding spot there too. Now with breast thermography, this has been an area that has been researched actually like crazy. About 800 studies or more have been published. And the main findings are that whenever we have significant findings or patterns that we see in a breast, there is an elevated risk of someone developing breast cancer in the future. Ideally, we do not want to use breast thermography as mining for cancer. Rather, we want to use it as a preventative tool. So when we see that there's some physiological changes and the patterns we know can occur years before somebody would actually get a structural change to the body, which would be detected by all the other tests that we have, like ultrasounds, MRI scans, mammography. All these things are anatomical tests that look at cross sections of the body, and again will only detect a problem when there's a structural change in the body, whereas thermography is a physiological test. So we're able to see physiological changes again years before somebody might develop a problem. And the whole idea with thermography, as I said, is to use it as a preventative tool. So when we see those patterns, we can say, hey, you're at an increased risk for developing problems in the future. Let's do a full court press with improved diet and lifestyle and certain nutritional supplements. And generally speaking, we can get people to have these patterns go away in a very short period of time, usually within about 3 months or so. And then it gives us an incredible way to really monitor what's going on with someone. If they run into, increased problems again, it's like, hey, time to do that full court press again. And so the whole idea is to stay on top of it so that hopefully a person would never develop any significant problems in the future. Now, this is a case point here where this individual had this pattern here. This breast is abnormally hot compared to this breast. So this puts them at an elevated risk of concern. We did diet, lifestyle, and nutritional supplements for 3 months. And this is what the follow-up thermal imaging shows. So we can document that our changes that we do in diet and lifestyle, and as well as taking the nutritional supplements, are things that can reverse these physiological patterns and restore somebody back to good health. Now, breast thermography, as I said, is something that's been extensively studied even since the late 1950s. There's been over 800 peer-reviewed published studies, huge numbers of women involved in these studies, and long follow-ups, up to 12 years or so. They've helped to kind of standardize thermography protocols. So again, telling us what are the different patterns that we're seeing that actually turn out to be significant ones, that we should count, and and which ones are not. And then using, again, thermography as this preventative tool, because it has this what we call predictive value. So in other words, when we see an abnormal thermogram, there's been all sorts of studies that have been done that have determined exactly what kind of risk is involved with that. So just kind of as a general statement, an abnormal thermal image is actually the single most important marker that we have for a high risk for developing breast cancer in the future. A persistent abnormal thermogram can carry up to a 22 times higher risk for future breast cancer. 38% with abnormal thermogram develop breast cancer within 4 years. And then some other studies have shown that when you have an initial abnormal thermogram, 33% of those individuals went on to develop breast cancer within 2 to 10 years, for a 6 times higher incidence over the general public. So all this is telling us is that there's a strong correlation between finding abnormalities on breast thermography and a future risk of breast cancer. And it may not be that high in the future. I mean, that long in the future. I mean, some things are showing up in 2-3 years. So it just tells us we got to jump on those then and get those things to reverse so that we don't run into future problems. Now, the reason we don't want to use thermography to mine, for breast cancer is because once you do have breast cancer, it can show up in a variety of different ways. So sometimes if the tumor is really aggressive and it's got a lot of a vascular supply to it, it's going to show up real hot. And sometimes we can look at those images and think that there's a very high probability that that person may have breast cancer at that time. However, we can also run into circumstances when nothing shows up on thermography, or we can actually see a cool spot. And this is not a failure of thermography. It's actually what thermography is telling us is about the physiology of the tumor. And so when people have nothing that shows up on thermography and known biopsy proven breast cancer or a cool area, it's telling us that those tumors are much less aggressive, extremely slow growing, in fact, and statistically, the outcomes of those are way better than the tumors that we see that have that high vascularness. So thermography can be used in addition to other testing to kind of improve what we call the sensitivity and specificity. It can sometimes detect tumors that mammograms miss or other of the techniques miss. Sometimes it's the sole initial sign, that we'll see. It doesn't show up on any other tests. The larger tumor is, the more likely we're going to see, thermographic changes associated with that too. So it's definitely a very helpful tool to be used in addition to other tools. And we always say, okay, no test is perfect. And we learned that kind of the hard way with mammography, where we thought that that was our golden standard, but it turns out that mammography will miss a lot of tumors, up to 50% in people who have dense breasts, and then overdiagnosis and a number, of other issues that go with that. So our learning, our hard lesson from that is that no test is perfect. And it's true for ultrasounds, MRI scans, thermography, all of them. And so what research shows is that by doing a combination of several different tests is when we get the very best evaluation of the breast tissue. And so I always recommend that in addition to doing thermography, you should also do an anatomical test. And ideally, my first test choices and using an ultrasound, because it's completely non-invasive and safe and relatively inexpensive. Now, thermography can be used to monitor women with breast cancer to see if we see any early warning signs, for instance, of the tumor coming back or the effectiveness of the treatment. And they've actually found that women that are using thermography after they've had their breast cancer care, that their long-term survival is significantly improved. And we can use it as a prognostic indicator for survival, as I mentioned just a minute ago or so, that whenever we see a lot of vascularity and findings associated with the breast cancer, it indicates a worst kind of scenario versus one that is looking like it's a normal thermogram or having that cold area. That gives us a much better prognosis for that patient. Okay, so now if we move on to the abdomen, now that on the abdomen, we have a tendency to see a little bit more vague findings there versus like what we see for the face, for instance, when things are directly under that skin. So in the abdomen, structures are a little deeper, but we do get that sympathetic nervous system response to the surface of the skin that's going to cause us to have some patterns. So in general, this is a normal abdomen. A lot of people will have coolness around the belly button, which is always hot. And that can either be just normal because there's a little bit more fatty tissue in that area. Sometimes people can have some digestive symptoms when we see this pattern too. Now on this particular one, we're seeing these areas of heat that are running vertically on either side of the abdomen. And those actually correspond with lymphatics. So that's telling us that there's something going on with that digestive system that's causing the lymphatics to get kind of clogged up. A lot of times this can be some early, signs of leaky gut or other digestive issues. This is a lateral normal abdomen. Normally we see very little heat there. And when we see a lot of heat there, that's the area where the liver is. So it can be an indication that the liver is stressed. Sometimes that can come from a whole variety of different things, from, drinking alcohol to emotional stress can actually cause these patterns as well. Now, drinking alcohol, kind of interestingly, this was a individual who's a thermographer, and he took images of himself one day, then drank a whole bunch of alcohol and took images of himself the next day. And this is what he looked like. So we call those mottling patterns, and those are non-specific because there's many different things that can cause them, from alcohol ingestion, smoking cigarettes, other toxicities, allergies, leaky gut syndrome, digestive issues, hormonal imbalances. And our goal then is to talk with the client and determine, okay, what's the thing that makes the most sense about why we would be seeing these patterns in this individual. These patterns are representing inflammation in the body. So this is a way that thermography can actually monitor the amount of inflammation that you have in your body. And that's hugely important because we find that inflammation is something that plays a key role in the initiation and progression of all chronic diseases, from diabetes to heart disease to Alzheimer's, and certain cancers, especially breast, prostate, and colon cancers. When somebody has systemic inflammation, this person did not drink alcohol the night before, but we're seeing these mottling patterns kind of all over the body. Usually they're not in the extremities. And when we see them in the extremities and in the face, then we know that this is like the most severe form of inflammation that a person has. And so that directs us as far as coaching them on how to do things to really decrease the amount of inflammation that they have in their body. This chart just kind of goes over all the different causes of mottling that I covered previously. Chiropractors can get a lot of value using thermography to determine what's going on in the back area in particular. On the right-hand side is a normal appearance. And then on the left-hand side, we can see that extreme amount of inflammation that's down in kind of the lower lumbar sacral area. When we get this area where the heat patterns will flare out to the side, that's called a flare sign, and it's oftentimes associated with the subluxation. So again, this is helping chiropractors to determine exactly what each individual patient has and what best type of treatment can be done for them. The bottoms of the feet are normally real cold. It usually gets colder as we go out to the toes. I mean, so cold you can hardly see them. The instep is always warm. It should be symmetrical. So that's what we're seeing here. Now we'll run into situations where it'll have more heat on one side versus the other. In the instep, that might be related to plantar fasciitis or a medial ankle injury. And I've seen those sometimes when people have had an ankle injury from a long time ago, several years ago, they'll still have this kind of heat pattern that will show up at the bottoms of their feet. We'll also see kind of sporadic heat patterns like this that usually is associated with abnormalities in gait. If somebody is a diabetic and they're prone to diabetic foot ulcers, we'll start to see some heat patterns on the plantar surface of the feet before they develop a diabetic foot ulcer. So again, allowing us to do some preventative measures before the problem occurs. Looking at the hands, this kind of pattern is normal. So we usually have a little bit of heat at the base of the thumbs, and then it gets colder and colder as we get out to the tips of the fingers. On this patient, we have more heat on the right side than what we have on the left. It's not symmetrical. So possibly this person is extremely right-handed and is using that particular thumb a lot more than the other one. Or it could be that there's an early sign of arthritis in that location. There's all sorts of conditions where we start to get too much heat in the overall hands. So once we get the whole hand is heated up, this is called a glove pattern. And when we see that, it usually indicates that the blood sugar may be elevated and maybe they're pre-diabetic or diabetic. So again, another, kind of subtle finding that we can have with thermography where a person may not have any symptoms and might not even know about it. On the palms, what is going on? Okay, wait a minute, here we are. Okay, we've got the heat patterns here that can either be from use or they can also, if there's any kind of pain that's associated with it, it may be related to carpal tunnel syndrome. And then finally, when we see red hot or white fingernails like that, that can be an indication of high blood pressure. Extremities will give us a lot of different information regarding your veins. So we'll see varicose veins or spider veins showing up. We're also able to look at the knees to see if there's any inflammation in one knee versus the other knee, because those should be symmetrical. Sometimes we'll see mottling patterns in the extremities, like I said, as an indication of more advanced inflammation. Now, reflex sympathetic dystrophy or complex regional pain syndrome is a condition that can happen oftentimes after an injury or after surgery, where the nervous system is doing something extremely abnormal, causing a lot of pain, and then affecting the perfusion of that extremity. So it gets super, super cold. And this is what it looks like when the reflex sympathetic dystrophy or chronic regional pain syndrome of the right hand. And then we'll see how this leg here is much colder too. So the thermography is actually the preferred test to be able to determine if somebody has this condition or not. Now, how the image is saved in the report that you get is something that's crucially important, and you would have no idea about it. But just to let you know that when a thermographer saves an image, it's not like there's just one setting on it when it's uploaded. There's actually, you can have a huge play as far as how much heat that you save it in or how much coolness. If it's saved too hot, it's going to look like there's a lot of stuff going on, when in fact there may not be. When it's saved too cold, it'll look like there's nothing going on, when there's actually some patterns there we're not really seeing. This is saved in a kind of temperature range we'd like to see, where we see the patterns that are going on in the breast. So just to be as a warning, don't try to be a lay armchair interpreter of thermal images, because there's a lot that goes into how to interpret them. And when I'm interpreting images, I have to do a lot of manipulation of the images in order to have them in the accurate way, seen in an accurate way, and then to do very specific measurements on them as well to determine what is significant or not. This is just another image to show you again how important it is as far as how these images are saved. The one on the upper left is actually saved too cold. The one on the right here is saved properly. And this one is saved too hot. So it's all the same image. But you could look at that and think, oh my God, there's so much going on there, when in fact there's not. So you really need to have a professional interpreter who's got the interpretation software to be able to determine if these images are significant or not. Now, when I'm doing an interpretation, I actually have to use the specialized software. The palette, or the color scheme that we use in the report, is considered one palette. I actually use 6 different palettes to do my interpretation. Some are accentuating the cold patterns, some are accentuating hot patterns, and then there's some that are called grayscales that look more black and white, and they can really pop the blood vessel pattern. So this is why sometimes when you're reading a report, and I'll describe what I'm seeing, and you'll look at the images in your report and you'll go, I don't know what in the world that woman was talking about. I can't see that. And the truth is you can't see it on those images that are in the report. And that's why I'm using all these different palettes for the interpretation. And the absolute temperature measurements are important, as well as symmetry comparisons. So these are the images of the different palettes that I use with the interpretation. This is the one that's contained in the report, kind of the medical palette that we use. This is one that I like to use because I can see very clearly these mottling patterns and vascular patterns. This is a enhanced grayscale, so it shows us very specifically where the heat is. This particular palette is really good at showing heat as well as isolated cold patterns too. And then just another, palette that gives us even more of a view of different areas of heat and cold. And then looking at the breast area, again, this is the palette that's included in the report. And then this is the gray palette that I use. So I can really see very clearly where those, blood vessels are, and then see those mottling patterns much more clearly than what I can see in this particular palette. So the best use of thermal imaging is to use it to monitor dynamic changes in general health, to use it as a health discovery tool. So we're using it for an initial assessment, and then we want to do follow-up imaging so that we can identify early changes, and really allowing us to keep a finger on the pulse of your health. And the moment we're starting to see some increased physiological changes or imbalances in the body, then we want to alert you to that so that we can get you on a healthy diet and lifestyle, and whatever specific nutritional supplements would benefit you most to get your body back into balance. And again, the sooner we can see those changes, then the easier that we can get you restored back into balance. So we want to use it for prevention, primarily. We can also use it for risk assessment, as we talked with the breast area in particular. We can use it for monitoring treatment. So again, just seeing, okay, are the treatment protocols that we have someone on, is it really working? Are we seeing that inflammation decrease, or whatever the abnormalities that we're seeing? And normally I recommend that when you first have thermal imaging done, that you want to do imaging of more than just one area. So we get limited amount of information from just doing breast thermal imaging alone. So usually we want to do a half body or a full body, because that gives us a lot more information about your overall health. And then in follow-up thermal imaging, we can follow up more frequently with breast imaging. Okay, so that is kind of the basics of thermography, medical thermography, and some of the ways that it can be used and it can benefit your health, and then also how interpretation is done as well. So I hope that this has helped you. And if you have any additional questions, please don't hesitate to contact me. My website is www.medthermsc.com. Thanks.